Please note, today's big interview is for adult listening. Do you have a burning sensation every time you go to urinate? Have you had a discharge? Are your testicles swollen? Is it painful? How have you been treating it? Are you one of those men who prefers drinking a trusted concoction, then assuming you'll be fine? There are those who do this quietly, assuming, it's nothing. And they return to their partners, not knowing if their treatment action was sufficient, and thus they create a new chain of infection. Worse still, even those who do seek medical attention when the pain is unbearable will sometimes still not tell their partners. Gauteng health officials say between April and December last year, 40% of men who came to their facilities were treated for male urethritis syndrome, MUS. The department says MUS data accurately reflects newly acquired sexually transmitted infections, and they've issued a cautionary warning about engaging in unsafe sexual practices. Gonorrhea and chlamydia are the most predominant causes of MUS in South Africa, and they're on the rise. Nichola Lutchman is the program manager for STI, PrEP and key populations at the Gauteng Department of Health and joins us now. Nichola, thank you so much about your time. I hope I've outlined the situation correctly. And if I have, how concerned are you?
So, yes, thank you so much, and good morning, everyone. So, yes, as a Department of Health, we are very concerned that we are seeing this trend in the increase on STIs. So, this is why we are here today, to educate the public, to say that, it goes down to behavior change. We know it's very complex, and we want to amplify our healthcare messages to say, as a department, we've got various combination packages of services which include your condoms. We can't stress enough how important condoms are in the prevention of STIs, including HIV. So that is why we're here today, to educate the public, to say please access them. If you have any of the signs that you've mentioned and symptoms, you cannot, treat it at home. Please visit your local clinic or your doctor and get it treated correctly.
Well, we'll talk about interventions in a moment, but just give me a picture of the extent of the problem, the patterns you are seeing, and what it is that concerns you.
So, like you rightfully mentioned, as a department, we're mainly monitoring the MUS incidence amongst males because it's a newly acquired STI. And we know males not necessarily having sexual contact with females, even with your LGBTQI community, that is men having sex with men. So we are seeing a high trend amongst the MSM community, even the people who inject with drugs, they're sharing needles. It can be transmitted via the needle sharing as well, including your pregnant women who, may have contacted the syphilis from their partner. So these are some of the populations that we're seeing a high risk at, and we're concerned and we're pleading, and it's a cry out to them. Let us be more, protective when we engage in the sexual risky behaviors.
You've mentioned demographics. Are there areas of particular concentration?
Yes, definitely. There are areas of high concern for us throughout the district. We have 5 districts in Gauteng province, which when we look at the Johannesburg district, we're looking at the central, the CBD, as well as the Sandton and Alex area. We know there's a high concentration of we have our high-risk population, your sex workers, people inject with drugs, even it's inundated with TVET colleges and your universities. As well as, one of our concerning districts is the smaller West Rand district in Merafong, where there is a large population of mine workers, and, these are areas where they're engaging in sexual or risky sexual practices. So these are some of the areas that we're going to really target with our interventions and ensure that people are more educated and have the correct package of services to protect themselves and know what to do.
The symptoms often come long after a person has been infected, don't they?
Yes, it depends. It could come, a few days or long after, weeks or months.
Why is it still difficult for particularly men to come forward?
So we know we live in a society where, men are said to be the stronger, person, and they hold these connotations that, we are not afraid. And by them just simply showing up at the clinic being ill shows that there's a sign of weakness. And we say, no, it's not a sign of weakness. We want you to take care of your health. You have families to see to. Your health is important. We have men's clinics that are running throughout Gauteng where you can easily go and, access them and talk to a male clinician if you don't feel comfortable talking to a female clinician. And, just indicate to them your health needs and you will be attended to, served with a smile, I should say. Yeah.
Is there, because one thing, after all the campaigns that promote sexual health, especially around HIV/AIDS, for example, where does the messaging get lost? I mean, in other words, are there gaps in the treatment programs, or is it a lack of adequate prevention methods? Where does the message get lost?
So as a department, I think we are doing what we can, but what we're saying is we really need to amplify our messaging. We really need to, push through with more outreach. People are not coming, regularly to the facility because of, issues like they're working at school. So we're saying as a department, we're really going to push through and amplify these outreach activities in our townships, informal settlements, and hostels, basically our hotspots, and even the communication. When we communicate, we provide counseling. We need to push through with the counseling, especially on the use of condoms and availability of condoms. We know that we have these, we need to really advertise our condoms in the sense that now we don't just have your plain, boring, non-scented condoms. We have really the available strawberry, vanilla, bananas. Let us popularize it. Let it trend as well. We want them to use it. And I think, like I mentioned earlier on, that is why we're here today with you. We want to get our message out to the community to say and reach people that we may have missed, What
are you seeing for women? A rise in syphilis cases, I understand?
That's correct, yes. So, like we said, when it comes to the STI, the MES, we are seeing a rise in the male, and then we know these are the partners of the female who show up at the facility late. They do not pick up a sign. They are not aware that they need to attend antenatal classes, antenatal care. And then from there, this is our education to women who are pregnant. Please access our healthcare facilities. Go through your routine checkups. Stick to your dates that you need to show up, because once you're there, we provide you with an HIV test and other routine screenings and healthcare needs, so that throughout your pregnancy you are healthy and you give birth to a healthy baby.
Nichola Lutchman is the Program Director for STI, PrEP and Key Populations at the Gauteng Department of Health.
Join us. This is 702.